I saw the in Ebola suit. You carry me. When I start asking, I say, but gay. And they say, oh, you were infected by the Ebola.
Ebola is real in Liberia because we see people dying for AR. For me, I saw Ebola patient. What blood coming from the ear, from the eye. Then at the same time, your family when you die in my presence, I saw it. Was populated. Right now, we cannot hide ourselves from Ebola because why? You can find some people they are 3 in room. You find some people they are 5 in room sleeping together.
You speak to somebody today, the next day, they tell you that person not make it. Ebola can't for the person not make it.
What had us really afraid was when we saw health workers dying. Those who should be able to attend to you were all dying. And because of that, all of the health facilities had to close down. There was nowhere malaria could kill anybody. Any sickness that is treatable could kill anybody because there was nowhere to go. JFK, which is a referral hospital, could not take anybody in because they lost many of their good doctors that we had in the country. So the situation was so scary to the extent that the information that we needed, we could not get information. Information was mixed. Even those of us who are on radio could not lay our hands on the right information.
The background of these countries is countries coming out of conflict with a very poor infrastructure, with a very small and under-resourced and under-trained health workforce, being overwhelmed with a crisis that even in Western countries would really severely stress the system. So against this backdrop, with on top of it the problem that, especially in the beginning, a large number of health workers got infected and given the high case fatality rate, the high numbers of people who die from the disease, actually quite a few health workers died, and that meant that others were afraid and didn't want to work anymore until they understood what it was all about. That there was very few people on the ground initially who knew about the disease, and there was actually very few people on the ground who were willing to deal with the patients.
Last year at about this time, people were afraid to come to church. Last year at about this time, when our people who were helping out in hospitals, the doctors were dying. Nobody to go to.
So in October last year, we had a planning meeting, and UNMEER had a planning meeting in Accra with all the key external partners within the UN and a somewhat slightly larger community. The Red Cross was there, the large bilaterals were there. And in that meeting, one of the critical bottlenecks identified in the response was ensuring that health workers received the necessary supplies, the PPEs, the protective equipment, received the necessary training to keep themselves safe and being able to offer good clinical services. And it was UNDP that said, okay, we will take responsibility for ensuring that health workers involved in the Ebola response get paid and get paid on time.
This is what we are good at. This is our bread and butter, providing support to strengthen institutions and building resilience. With the Ebola crisis, you have to look beyond the health and the epidemiology. You really have to look at a whole network of response actors, those working on the health side, those working on the admin side, on the operational and logistics side, as well as providing support for systems to work. It was important that if you have a massive operations, you have a number of people who will be working from different sides, who will all have to be paid.
Before the Ebola outbreak, there were huge conflicts within the health sector. Health workers not being paid, overworked, not having received salary for months in some cases. So there was a There was let's say, a chronic problem within the system that had to be addressed. It had to be addressed because we didn't want people to walk away from what was really a clearly very an acute medical need.
We had a human resource capacity gap because it was a strange phenomenon for us, so we needed to recruit additional staff to come and aid us in combating the virus.
Generally, we started with awareness, telling people wash your hand, beware, Ebola is here. And so when we found a case, we do the case investigation, get the case history, go get all of the contact listed, and then we call in the contact tracers. Contact tracer can do investigation and start to do a monitoring on those contacts for 21 days. But we have a serious challenge with the community. People said that we were paid by the government to come and spread Ebola in the community. Others said that we were enriching ourselves, and others said, in fact, there was nothing called Ebola. So in the midst of denial to get the virus out, it was a challenging situation.
I think Ebola to be here because in my community, I see Ebola patient.
Everything went apart, fell apart. There was body all around here. But with the ill and the courageous work of our health workforce, today we can walk in the street and say we don't have an Ebola case, and we are counting the days to declare Liberia Ebola free. It's because of what the health worker did.
When I started feeling bad, I said, I don't think I can work any longer because people are just dying. You know, when people die, you feel so bad that you are not helping, but you are there helping. But to see the kind of death that was going on, it was terrible. But thank God that we gained courage and we were there to help our people. But it was terrible.
When you see Kim, who left, go to my mother-in-law place. Like the place where my children, my husband, myself. When we were there, one girl in a horse, she my son play my beast son, which is 9-year-old child. So she made friends with the labor as place man for him. That the girl will get the virus. But we never knew how the virus can come. So the girl was sick, my son used to help her. And myself, I start helping. Through helping now, my son get the virus. Before I come back, the whole horse, nobody survived. Only my one survived in the 2 horses. Yeah, that way happy.
President, we are here at the James Spirit Field, and I'm about to pick up for Gueju, going to the county on a trip for UNDP. And my trip has to do with meeting the county health team in helping them with the Ebola response payment process.
So if we didn't have helicopters to fly people out there, I went up to Voinjama last fall in September and October via car. It took us 2 days. We'll be supporting the county health offices. They will have a focal point at the county health office, and they will help them collect and verify information about Ebola response workers, who was working, for how long, when did they start, and then in addition also collect and verify information about complaints around payments. In addition, we provided motorbikes for all of the UN volunteers.
Okay, my name is Jiba Kamara. I work with UNDP as UN volunteer. Basically, our job is to follow up on claims and make sure that the claims are authentic, and we make sure that the health workers receive their pay. If they are not receiving their pay, we want to know where the problems are and how can we follow up with the Ministry of Health and other partners to make sure that they receive their pay on time.
Provide this information to him. It will be recorded with us. We will also provide it to the Ministry of Health, and then Jiva will also be doing follow-up.
Yeah, they are not feeling too good because some of them are saying that they are on a very short-term contract. Ebola will soon be finishing and they will not be receiving job. And some of them saying that they are not received their hazard pay for some time now. So there's a need that they receive their pay. and they are quite worried because they need money, they need to be taken care of because they took a lot of risks during the Ebola period. It's a very good experience for me. I've been able to work for humanity, see people, talk to people, come to strange places, and to see how best I can help my country.
I see your money now here. You consult me sending my money to Global Bank. It is right under the labor law, under the Geneva Convention.
They decided that it was worthy taking a risk, something that is not totally within your control. Things will go wrong. There is money involved. And nevertheless, in October last year, when, mind you, things here were really, really very bad, saying, yes, we will put our muscle behind this. And they really did put their muscle behind this, because after those lists were created and after it was figured out who was supposed to be getting what, recognizing that actually there are no banks everywhere, not everybody has a bank account, there was actually UNDP staff working together with Ministry of Health staff, getting on an unmanned helicopter with bags of money and actually going out and pay health workers money. There was visible signs of commitment to them. Well, allowed them to actually focus on the work that they're supposed to be doing rather than worry about their livelihood. So great job, really.
The doctor and nurse said they did well. They do well for us, so when we were not done, they will finish in the country. Everybody finish.
Efficiency was important, but effectiveness was much more important at that point. Just get the work done.
The payment program for Ebola response workers has 3 different components. The first one is information management, the second one is strengthening payment systems, and the third one is developing an operational contingency plan. So under information management, we've been able to collect the information around payment programs and that kind of thing and provide that information publicly on a website that was designed for Ebola response workers to look at.
Yeah, one of the challenges is that they have too much bureaucracy in the payment.
We have like funds coming from different agencies like World Bank, AFDB, and most of the UN agencies. And those organizations have been struggling to be able to reach the Ebola workers, mainly in the counties. The whole essence of the program is to facilitate those payments. The first challenge is to establish a list of Ebola response workers, which is being made by the country health offices. Once that list is made and verified by them, it's sent to the Ministry of Health, which review the list, verify them, and then send them to the Project Financial Management Unit, which is a unit of the World Bank, which is located in the Ministry of Finance, and they're the one ultimately making the payments. Then EcoBank disburse the fund or make direct payment into the Ebola response worker account for the ones who have accounts. For the ones who don't have accounts, we're making offsite payments.
So response pay is for healthcare workers that are working in healthcare facilities or doing things for the Ministry of Health but aren't necessarily directly involved in Ebola treatment and or response. And then hazard pay is for the people who are specifically working in ETUs, safe burial teams, ambulance drivers, that kind of position. And so it's a bit complicated because there are a couple of different kinds of hazard pay or response pay and 3 different kinds of workers, and trying to figure out who fits where can be a bit complicated, and trying to make the lists, especially because as Ebola was happening, everything needed to move very quickly. And so shifting those people and trying to keep track of who was shifted where and so should be receiving what salary was a bit cumbersome. It took a long time to straighten out.
Okay, some of them went there, they have not received them. So, but you did follow up, or we...
Are their names on this list?
No, their names are not on it.
The second component is strengthening the payment mechanisms, because one of the issues that we have now is that in Monrovia, there are several different payment mechanisms available, and they're fairly strong. Outside of Monrovia, it becomes much more difficult. There are, out of 15 counties, there are 4 that don't have any banks at all. Many of the other counties maybe only have 1 bank or 2 banks in the entire county.
And then liquidity is an issue, and just getting money to the banks becomes very problematic, especially when there are issues with roads and electricity. There is mobile money in the country, but out of four mobile network operators, only one has mobile money, and liquidity has been a really big issue. So people will go to agents in the field and they may not have cash available.
Walking through the bank, I think, is the way forward. Making sure that everybody has the bank account and the IMS team can supervise and then pay everybody with accountability and transparency is key.
UNDP have been there from the beginning, especially from the HR component. Let me speak to the HR component. They help us compile the list. They were there arranging with other UN agencies to arrange flights to fly out to go to the counties. Today, we are privileged to receive a donation from UNDP. We are able to get laptops. We are able to get printers, stationaries. So they've been very, very helpful. They've been in all of the meetings, the HR task force meeting. They've been there giving our input. They've been there giving the pieces of advice. So that I said, yes, they've been on board from day one, and they will be on board until we end the process.
Now that we observe that Ebola is almost going to zero balance, with that, I'm happy. I'm happy.
I have worked in the United States for many years. I served as a county health director in North Carolina for over 6 years. And so I was brought back to Liberia through UNDP, through the Top 10 program. The IMS is basically a command structure that directs what occurs within the incident, that is the Ebola incident in Liberia. So our role is basically is an operational role, running the operation of how to contain the disease in the country, working with the various partners, but everyone basically reports in a unified manner.
Good morning, this is the National Ebola Response Call Center. I'm Agent 37. How may I help you?
We've provided payment for IMS staff in January, and we're getting ready to provide another payment in a couple of weeks.
The IMS itself, a lot of people have said this. I don't think we can say it enough. It's an exercise that has proven that national leadership works, and that if it's properly organized and if it's properly and adequately supported, like it's been, that we can actually get much more done working together behind the national system. The IMS has proven that. They've worked very well, they've supported coordination, they provided a platform for unifying the response. And I think this is a legacy that should be built upon.
When I started coming down with the signs and symptoms, I started feeling headache. I couldn't even talk. I just remained stiff in our one place. And then the health team came and just picked me up and carried me to the ETU. And then I was there for 21 days. They will serve you, they will take care of you, they will look after you. You can't be a burden there. The people that are there, they treat you, they are their own parents. They take care of you. When I came back from that place, some people were afraid, but yet still, people had like chokes in me. And then I decided to explain to people the situation that went on there. That's why I was stigmatized. I stigma on me. And then anyway, I go, people want to say different things. But I was in the process of defending myself that I'm Ebola free. And today I with my community people are in the process of teaching. There are parents who still have that choice, who they believe that I'm Ebola free. They send their children to that school. And that school today, you see that school, bit by bit, we are moving forward. First number, I give free ride. But the second one, no free ride.
As part of this responsibility, It was also important that we ensure that systems are built to fill existing gaps, but also to answer specific questions in terms of what the system's requirements will be going into the future. Not just responding to crisis in the future, but ensuring that the system is ready to take on the responsibility of future increases and complexities that are required in governmental operations.
We're working on a banking sector diagnostic to specifically look at challenges with banking in the counties and provide recommendations to the government and to the banking sector.
Prior to Ebola, the country had undergone the Civil War, and after the Civil War, we had some partners helping to build the healthcare system. We thought we were building a stronger healthcare system, but Ebola proved to us that perhaps what we were doing was not good enough. And so it exposed us to so much. So there is a need to build and harness the healthcare response in the country. That takes into consideration the diagnostic ability of that country. So we talk about CT scans. We need CT scans in almost all of the major hospitals around the country. We need MRI. We also need the ability to train people.
There are things we change, but as we say, Monrovia is not Liberia. We are in Monrovia and we see what is being put into place. But what about the rural areas? There are places in the rural areas that are not accessible.
Very common to find villages or communities where pregnant ladies about to deliver have to be carried for 4 hours on foot before they can reach the nearest health facility. We've now been focusing on taking out medical services out to the communities. So our main activity right now is the mobile clinic, whereby 3 times a week we are going out to hard to access places, places with no clinical facilities, no clinics, and we hold a free medical camp for the people living there.
The next thing for me is that go back to school, earn degrees, other higher degrees, and go back to the health center and continue working.